Hello, this is Dr. Bob. Welcome to the next series of my discussions around NCLEX success. And this focus for this session is on curriculum and instruction. So there's all kinds of programs, approvals, I'm sure as you know by your state boards of nursing. You all must be approved, and the various processes by which that is accomplished, curriculum requirements, and particularly clinical experiences, or hours, should I say, are vary by state boards of nursing. And if there is a program accreditation, there's also regulations and requirements that need to be followed within that particular parameters of that accreditation process. So with these safeguards in place, why do students still not receive the required content in order to be successful in NCLEX? And obviously, many of you are doing a fabulous job, and your NCLEX scores are remarkable. But others are challenging and challenged, and that's the whole the reason for this whole series is for those of you who do have challenges, how can we work with you to improve and ensure student success? So the next few slides will discuss the reasons and steps that can be addressed to address this issue from a curriculum and instructional perspective. The number one reason is the NCLEX test plan changes and adjustments to the curriculum content has not been updated. Now we've got another NCLEX test plan change coming out next year. And so this means that you have to be aware of what the changes are and go back in and ensure that those changes have been integrated into curriculum. But from my perspective, and by the way, these reasons are just Dr. Bob's based on my many years of experience in a variety of academic positions, are why there are problems with student success. So number one is NCLEX test plan changes. Number two, faculty have not kept up with test plan changes in the content in which they teach. They tend to use the PowerPoint slides they've used for a number of semesters and perhaps lecture notes without any updates or any innovations in teaching. Kind of get in a rut that this is working, so I don't have to redo the lesson plans or other things, which I'll talk more about in a minute, but that's the number two reason. Looking at the third reason, teaching methods rely primarily on student recall and do not engage them in an active learning. You probably heard the phrase death by PowerPoint. If you want to go in and visit your classroom, this is for deans and administrators, simply see what happens is a whole session, basically a PowerPoint presentation. Then of course students all want copies of them posted on the learning management system or some other way, because they think that if they study the PowerPoints that they're going to be successful. So this is, from my perspective, the number three reason. Number four is test compromise, resulting in academic integrity issues. Students are so innovative, should I say, in how to beat the system in terms of cheating on exams. It's just unbelievable. And perhaps I could give you another session just strictly on academic integrity and strategies and how to address these and hopefully prevent them from occurring, because it's rampant in our society and in nursing schools in particular. Faculty reuse the exams with little or no updates. And so this is problematic because even though you may try to keep copies of it, there's a variety of techniques students use to help keep track of those questions and share them with others. And so if you use the same one over and over, it's not going to work, because you're not measuring any valid, you're not getting a valid assessment of their knowledge. And then not using NCLEX format questions is a very common one. Using true and false and those types of things that are not NCLEX formatted, so the students do not have to think in the NCLEX way, if you will. And continuing the test bank, use of test bank from textbooks. They're compromised. They should never be used. If you're going to use them, you need to make significant modifications to them so that they cannot be recognized from the students, because they know how to go in and find them. There's also a variety of exam preps out there that they go to and they can use, and if you're using any of that kind of information to create your exams, believe me, they will find it. That the test plan there's no mapping of the test plan to the curriculum. It's faculty are just kind of doing their own thing, and I guess in the guise of academic freedom. And so there's inconsistency, and it's left up to faculty that have varying levels of expertise in how to create exams. It tests non-essential information. It's asking extraneous information that may or may not be relevant to being successful on the NCLEX. And the most common issue often seen is that the material is covering, the exams cover too much material. How often have I seen in syllabi, the exam's going to cover like, 6 or 7 chapters of probably 400 or 500 pages of material. And then we expect students to figure out what's essential and not essential to do well in the exam. Totally unacceptable. The number 5 reason is grade inflation. Very, very common that you see all A's and B's and very few C's, so that there's no discrimination between student learning. And this is because exams are too easy, or maybe because of academic integrity issues. And also what often occurs is that the course grade is not, at least from my perspective, should be based on at least a 80% objective testing and 20% on subjective, meaning your papers and care plans and things like that. Because it's the objective testing that's going to be critical in measuring student success on NCLEX. And then not properly managing questions that are challenged by students. If you simply give everybody credit for an ambiguous question, then you can also have significant challenges to the validity and reliability of your examinations. The 6th reason is common, I think, and often in the age groups that we see entering nursing school these days, is the motivation and lack of adequate preparation, primarily from their secondary level of education or their commitment to work and school and being a student that needs to focus. Often these students have been used to having things kind of handed to them, not a lot of work involved, but as you know, in nursing school, you're not going to make it if that is your attitude. So changing that motivational factor is very, very important, and I find that when it doesn't occur, this also is a major reason for students to fail. And an admissions decision is not based on evidence-based findings, admitting students who are already going to be set up for failure, and it's shame on us as faculty if we do that. Now, let's look at some recommendations. The first one is mapping. You need to map the entire curriculum to the NCLEX test plan, and there's a variety of strategies that can be used in order to create that. It includes a review of student learning outcomes, which should be your guidance, and your State Board of Nursing should initially approve those, as well as your program accreditors. But times change and you may want to make modifications, and you need to go through the necessary approval process to do that. But it's not a simple step, because it has to then be linked to all of your curriculum, the course syllabi, learning activities, all that kind of stuff. It's not just something you can do in a silo. You may also want to include a vendor specialty testing. I really recommend that. There's a number of excellent vendor products in regards to that, which is kind of a secondary assessment of student learning. There's a variety of ways of how to handle that in terms of course credit, or how you're going to include it as part of the evaluation criteria. So there's a number of best practices around that, but I really encourage that type of support. And the second recommendation is a syllabi. The syllabi need to be updated then based on your mapping. and that there needs to be a linkage to the student learning outcomes and the course objectives, which should be measurable, and that there should be an assessment percentage for the course. The objective percentage I mentioned, like I recommend 80% for the course grade. Review the scope of the reading assignments and homework for each week. Now, I know there are some accreditation requirements depending on the length of your term. I don't mean accreditation, the Department of Education requirements, that in order you have to meet so many hours in order to meet federal guidelines for student financial aid. But be cognizant of how many and what type of material you're asking students to do. I highly recommend the integration of vendor resources into the courses. As I said earlier, there's a number of products that are just excellent, that are very useful to both faculty and students. The third recommendation is lesson plans. Now, I get that these are time-consuming, but they should be created for each course, for each topic in the week, or in the term, should I say, and map to student learning outcomes and the course objectives. And these will aid in ensuring there's an evidence-based foundation congruent with the NCLEX test plan. So there's a variety of formats can be used, and this is where a consultant can be very useful with you to help the development of the protocols for this. But it needs to have specific weekly objectives linked to the student outcomes, as I said. The textbook vendors can be very helpful in helping to develop this process. And you need to include all domains of learning to accommodate various learning styles. And that's a whole separate mini-series that I could give just on how to create lesson plans, because to my perspective, they're very important. The fourth, let's see, hang on. The fourth one is in regards to faculty, and we've already had I had a video already on faculty success, so I encourage you to review that, because faculty are critical to your student learning outcomes. To students meeting their student learning outcomes and eventual success on the NCLEX. So they have to be competent to teach, and they must have a orientation, and that it covers the essential information they need. They need to, in my opinion, assign to a mentor who can work with them one-on-one in a non-supervisory capacity. Administration needs to make classroom observations, provide assessments and coaching, ensure that they're following the lesson plans, and if the coaching fails, to move quickly on a replacement. Having a poorly performing faculty member in a classroom can be deadly to your NCLEX success in student learning. Now, the fifth one is in testing. Need to have a test blueprint that maps each course to the NCLEX test plan. And again, there's a variety of ways to do that, and faculty have to make decisions on the domains that they want to use. Again, a use of a consultant can be very helpful in how to do this process. Need to have predetermined values for those questions that will be asked related to client needs, cognitive level, and the nursing process. Various courses should have a higher level that, say, someone may be recall and, knowledge, and others may be more of an integration type of question. I recommend a test review committee. If you have a course group where you have multiple people teaching in the course, from like providing the clinicals or whatever, or at the school level, a test review committee to look at all of the exams pre and post to ensure they're mapped appropriately, they're NCLEX style questions, you're looking at the analysis, etc. It's extremely important. And I know sometimes with faculty, freedom, if you will, or you just let them kind of do their thing, and you can imagine what would happen in, say, for example, a pilot flying an airplane. If he or she just did whatever they thought they needed to do and didn't follow a recommended protocol, you could end up in disaster. And it's the same thing with these examinations, because these are the heart of student assessment, and they need to be carefully managed. And I would consider developing a test bank depending on the size of your institution. There's a variety of tools on how to do that and how to save them, how to randomize questions, how to build on them, assess the questions, and so you really develop over time a very robust test plan. Electronic scoring is critical. There are some free softwares that you can use to accomplish that, often made available by some of the textbook publishers. And a very rigorous academic integrity policy is critical. Now the sixth one is in terms of the skills lab and simulation. The skills lab integration with content is extremely important, and it should include competency testing, which allows students multiple opportunities to test out on a variety of skills. Simulation likewise should also be fully integrated in the curriculum. Most states allow a component of your curriculum to be met through simulation, but if it's not fully integrated and following some of the models such as Jeffrey for instruction and evaluation, you may be wasting your time on this valuable resource. And there's ways of doing simulation, by the way, without having to spend thousands of dollars on these human patient or human simulation patients, I guess you might call them, the ones that come with the computerized voice and sound and all of that stuff. And then dedicated simulation staff is critical. I found that if you simply have faculty do their own thing with simulation, it's very inconsistent, and you need to have a dedicated person, even if it's a part-time person, into that role. And it should be treated as if it's a real clinical experience in terms of, washing your hands before you start to do anything with the patient, the wearing of the uniform, etc. And I would encourage competency testing and managing a variety of clinical conditions as one of the requirements for passing the course, particularly the clinical component of the course. And again, a consultant can be very helpful to you in doing this. The seventh recommendation is your systematic plan of evaluation, or whatever you're calling your evaluation protocol. It has to be a map to each of the accreditation standards, or if you're at the State Board of Nursing and not have a program accreditation, it needs to be mapped to that. It needs to have measurable outcomes with timeframes for both when it's going to be achieved and assessed. It should be a working document and should be used in faculty meetings as a living document to guide your engagement and how well you're doing in measuring these various benchmarks against what you're doing. My suggestion, you bring it into your monthly faculty meeting, and if it's time for an item to be reviewed, you review that, make your notes, do what you're going to do in regards to assessing it, and so you're always the living document, staying on top of it. Data management is critical, and often I find this is a huge area of neglect. They don't have anybody assigned to manage the data and keep track of all your various exams and course grades and satisfaction, and it's just multiple endpoints. Again, a consultant could be very useful to you in creating kind of your template, how you're going to manage all the data and how you're going to do it so you can be integrated into your systematic plan of evaluation. I would also strongly encourage the use of gap analysis, particularly when students are not doing well in a course, or when you're looking at the vendor specialty exams and you're comparing the national benchmarks as to how your students are doing. Using a gap analysis is extremely useful and provides excellent feedback to curriculum and to faculty. Other thoughts, skill labs support for students is important, having someone there to help them. Oftentimes you can do this through a variety of videos that are available that they can watch repeatedly on a DVD or something like that. Many of the textbooks have these support material available. Student peer mentoring can be useful, as I mentioned in an earlier series, about a senior buddy system. This can be useful. There should be an academic coach assigned, and this is typically a nurse, Maybe just have a half-time person depending on the number of students, or you may need 2 people that meets with all at-risk students. There should be a weekly or bi-weekly meeting where all at-risk students are discussed. Administration should use a tracking system so they have real-time information about students' performance on examinations. And there's a variety of softwares that are available to provide that kind of feedback to administrators. And you, or faculty, can simply refer these students who have failed the exam to this committee so that can be looked at in kind of an intensive case management approach. And then this then helps with both the faculty member and the academic coach to help engage the student in creating this caring relationship. Because we do know that if students feel like someone really cares about them, they'll do everything they can to be successful. So this retention for an intervention for at-risk students is extremely important, and often I find that it's not used the way it needs to be used. I guess it kind of goes with the philosophy. From my perspective, if you're going to admit a student, then we have an obligation to ensure they graduate. The supportive campus learning environment is very important. There are even a variety of techniques used to ensure that the campuses are supportive, and in fact there's some architects that help with that. If you're going to be building a new building, you may want to think about how to create these learning environments. If you'd like to learn more about some of these things and have some consultation in regards to that, me and my associates would be more than happy to meet with you. A lot of these things can be done on virtual conferences so that the cost is relatively small. Our fees are very reasonable, and I think you'll find significantly below what you're going to find on the market. Because we're very interested not in making a profit at this, because at my stage of the career, it's more of a goal to help improve our student success, because we need all the nurses we can get. Dr. Bob.